Hi, everyone. I'm Norma Loeb, founder of the Lewy Body Dementia Resource Center. This video series has been created to bring awareness through firsthand experience of people living with Lewy body dementia, their caregivers, and through expert physicians. This crucial information will be shared with healthcare professionals, with families, and the general public to heighten awareness and to enable correct diagnosis. Please know we are here to help you every single day on our live helpline. I thank you for watching.
I was a principal at the time, and it was actually right before retirement. I started seeing changes in myself as far as decision-making, problem-solving. I was a principal of a 1,200 student school. I never second-guessed myself. I always felt very confident, and I started to see things deteriorating again several years before I retired, and I was 62 years old at the time. And I was a little nervous about it. I didn't know about Lewy bodies. I really didn't know. I heard of Alzheimer's before, but I really knew nothing about them.
14 years ago, both my husband and our adult son, though our son was only 16 at the time, and I thought that Paul had developed a phobia of some sort because he was very fearful of driving and became a terrible driver, and I had to take over. He thought he had developed a phobia. He went back to therapy to try to deal with his phobia of driving. But then when we were on vacation down in Belize, we were walking on a dock, and the dock had to be 20 feet wide to go down to a boat. And he wouldn't walk on the dock because he was afraid to fall off. And now that I know about Lewy body dementia, I realize that all these fears and all this perception of falling and a lot of fears like that were the beginning of the visual distortions that were happening in his brain.
Early signs that we see in dementia with Lewy bodies are changes in cognition, which can be changes in memory, whether it's short-term memory or long-term memory. It can be changes in executive function and ability to plan or balance a checkbook or perform multiple step commands can be difficult early on. We oftentimes see changes in sleep patterns. So something called REM behavior disorder starts fairly early on in dementia with Lewy bodies. And really what that entails is while someone's sleeping, typically their body is actually fairly paralyzed, so they don't act out their dreams. But in this condition called REM behavior disorder, or RBD, patients tend to start acting out their dreams and yelling while they're sleeping. And that can actually lead to injury if their dream involves them chasing something or reaching for something. And they can actually fall out of bed. They can swing their arms and hit a lamp, hit a desk, or even hit their spouse. And so this specific disorder is really only seen in Parkinson's and dementia with Lewy bodies. It's not really seen in other disorders. But on top of those symptoms, we can see changes in personality, in behavior, they can develop hallucinations or delusions. They can develop what's called Capgras syndrome, which is essentially inability to recognize a significant other, someone they've known for a very long time. You may not recognize their face or think that they're somebody else. Patients can also develop more anxiety, more frustration, even if they've never really had these symptoms before, and even if there's no trigger for them. So these are all symptoms that you can see in dementia with Lewy bodies. Some of those are more or less specific for dementia with Lewy bodies, but some are non-specific and can be seen in multiple other conditions.
The second form of early sign that I had was walking to a gate at a airport. And the further I walked towards the gate, the more I was losing control of my legs and ending up kind of in a stooped position. And the TSA attendant gave me a cane, which helped a tremendous amount. And I use a cane to this day. to help with that.
Some of the earliest signs that my mom showed of Lewy body dementia came before and right after my younger brother died of pancreatic cancer. She was having trouble tracking some things, and she asked me for help with her checkbook, which she normally had a lot of pride in doing herself. She had a few times where she told my other brother and I that she had some hallucinations. She had a lumpectomy for breast cancer, and we thought they were probably caused by the medication she was on post-surgery. And so we kind of dismissed those hallucinations, but then she was asking for more help. I noticed a little bit of a tremor in her hand, but not much at all. Depth perception was causing trouble for her, and she thought something was wrong with her eyes. And then she told me she would sometimes see little bunnies hopping on the hallway next to her in the carpet, and those hallucinations. So my brother and I continued to just pursue evaluating her, and then she was eventually diagnosed with Lewy body dementia.
And in December, out of nowhere, all of a sudden I got lost, hallucinations, major trembling, every imaginable Lewy body symptom all at one time. And it was obviously scary, and we had to go to the emergency room. And they did not diagnose me. They really couldn't figure it out. And the family doctor sent me to a neurologist. And then once I heard that those prior symptoms were related, that was really new news to me. And also a runny nose. I've had a runny nose for years. No one ever said it was related.
As people probably know by now, I was first diagnosed with Alzheimer's. And I was told I had Alzheimer's and to use it or lose it. And that was it. I was given all the advice. And it wasn't until a couple of years down the line, because my wife Elaine's been a carer, professional carer for 30 years. She thought there's something wrong here. This is not Alzheimer's, not as I know it. And I was quite lucky to talk to a consultant from Newcastle who's done a lot of research on Lewy bodies. And when I explained about the hallucinations, the symptoms, the hallucinations and the night terrors, and the smells of smelling things and seeing things that aren't there, the consultant said, this lad, he's not got Alzheimer's. He's got Lewy bodies, because the symptoms are hallucinations, more so in Lewy bodies than any other dementias, and seeing things that really are there. I really see them, but nobody else does. And also smells and hearing things like people's voices, And it was petrifying. But once I knew what it was, I could do my research is what I did, because when I first had Alzheimer's, or when I was told I had Alzheimer's, I'm more kind of these people that you wouldn't go to war without knowing your enemy. So I learned as much as I could about Alzheimer's, and then next thing I know, I had Lewy bodies and not Alzheimer's. So I had to do it all again. But it was worthwhile doing that while I was still in the early stages.
I think there has been a misdiagnosis, because the concept of Lewy body is much later than like Alzheimer's. People weren't even talking about Lewy body disease as the second most common form of dementia until the 1990s. And so there is much less of an awareness. And I think that, everything that's cognitive impairment is not Alzheimer's. There are multiple forms of dementia. And the misdiagnosis is from both misinformation, lack of knowledge, as well as overlap, right? So there are overlaps with Alzheimer's disease, with Parkinson's disease, and with delirium. So because of the overlap, because of the symptoms where maybe somebody with Lewy body doesn't have as serious cognitive deficits early, but it may be more attention, visual, spatial, sleep, depression. So it can be misleading.
When we first started to question what was going on with our dad, it was very frustrating for us because we looked back at some of his medical records and the referrals that he was getting for individual symptoms of what turned out later to be Lewy body. Those things started about 10 years before his diagnosis. We knew he had restless leg syndrome. We knew he had, eventually he started with the REM sleep disorder. And what else then he started losing his memory and we started putting together the pieces of the puzzle.
Repeating himself a lot.
But doctors were very interested in their separate diagnoses and no one really put together. As a matter of fact, when we look back on his medical records, someone says, consider Lewy body dementia, and no one referred him or followed through.
Well, it took me a long time to get my diagnosis because even though the doctor I went to was an expert, she said, I really think I know what you have, but I don't want to put a name on it yet. And this other neurologist I went to gave me a different kind of dementia. But when I finally, my insurance wouldn't pay for a lot of the tests. So my doctor couldn't verify that you had Lewy body. It took me 3 years to get my insurance company to agree to do a DAT scan. And through that, they saw the tangles and the things in my brain that they call probable dementia with Lewy bodies. The only other way to say you do have Lewy bodies is to do an autopsy on my brain.
He may have been misdiagnosed from the beginning, and but I honestly, I'm a nurse, but I never heard about Lewy body dementia, so that didn't even occur to me. I thought it was early Alzheimer's, and we took him to the urologist. As I said, he did a slew of tests, and then he decided it was early cognitive decline. And then we took him to a functional medicine doctor who gave him a whole set of herbal supplements. But they also did a lot of tests, including the genes, checking his genes, and a whole set of blood tests.
Where we got her to the first doctors, neurologists, and the neuropsych exams, and they were even very cautious. They didn't want to say, this is this or this is that. In fact, Lewy body wasn't even, the diagnosis that they came up with was that she's got major depression. That's the biggest thing. And she has some mild cognitive problems. And from her CAT scan, there was, they did see vascular injuries. So her diagnosis was dementia, mild cognitive impairment, Alzheimer's, and vascular mixed dementia. Not Lewy body, I don't think, they never even mentioned it.
Diagnosing Lewy body can be a little bit of a challenge for a number of reasons. So first is that different people are different. So depending on other diseases or conditions that someone may have, it can be more or less challenging to see the same symptoms in different people, right? If you also have arthritis, if you also had a stroke, if you also had some other problem, then it could be a little bit more challenging. Different people could be on different medicines. Also, the disease can just present differently, either early on or later. Some people have all sort of the textbook symptoms that one would read about, but some people have some of them. Some people never get hallucinations. Some people see things and they hear things and not just see. Some people have a lot more Parkinsonism, in other words, stiffness and movement, rigidity, difficulty walking. Some people either never really get that or they get that very late. And some of this, we don't really understand why it happens. Some of it is that people who have Lewy body very, very often have at least one other disease in the brain at the same time. Many people with Lewy body also have Alzheimer's disease at the same time. Many people with Lewy body have blood vessel damage in the brain or vascular dementia at the same time. And then there are other factors that we don't even understand, but there's a pretty wide variety.
I noticed this and I was having trouble doing things that were normally easy, shall we say. In other words, I can remember walking many times into the utility room to go to the bathroom instead of the bathroom. And I've lived there many years, so I know where the bathroom is. I was having trouble remembering. I had a short-term memory, and I still have that to this day. Short-term, long-term, I still remember everybody. I have recognition of my brother, life, and everything. But I can walk from I have a little study where I stay a lot. I can walk from there to go into the kitchen, which is 10 steps. And by the time I get to the kitchen, I've forgotten while I'm in the kitchen.
So one of the symptoms that we often see in dementia with Lewy bodies is cognitive dysfunction. And that can vary from short-term memory issues, long-term memory issues, planning, math, following commands. And so that's an early symptom that we see in dementia with Lewy bodies. And it's sometimes can be very complex and difficult to manage. Really the best way that I found to help that is with a very good speech therapist, because they actually can do cognitive rehab and they can kind of figure out where the deficits are and try to work through them. Because there's no real magic pill for the cognitive aspect of dementia with Lewy bodies. And so along with working with a neuropsychologist to kind of determine where the problems are, the speech therapist and good cognitive rehab can really help. And they'll give families a lot of tips and tricks when things get difficult. And they'll also try to improve the things that are potentially able to be improved.
There was no way I could balance a checkbook or do any of, I just lost all that capacity. And luckily, that is Jerry's strength. So he's really strong on numbers and all of that stuff. But I got worse at that. And then sort of, because at that point we were still living in a condo on our own. But what I started noticing is I went to the certain grocery stores that I knew exactly how to get there, and I didn't have to deviate from that. But if, let's say, we went to a new doctor for Jerry for some reason, I'd get this really high anxiety. It would be like I have to do a trial run so I know how to get there and make sure we get there on time. And Jerry would be like, oh no, it'll be fine. Just, you just follow your GPS and it'll be all right. And I'd be like, no, you don't understand. I'm just really anxious about this.
Several years ago, we started painting, and he is been pretty active in that recently, especially since we moved here. But he's losing some of his ability to paint the way he used to. I don't know whether that's part of Lewy body or what, but when we lived at the other place, there were several people in the art room with him, and they would talk and offer criticism to each other and everything. Whereas now he's pretty much in the art room by himself. And maybe that's a reason, but his art isn't nearly as good as it used to be.
I cannot read a clock. Some things I can't remember. I try. I went to put a dish towel up somewhere, and I ended up throwing it in the dishwasher instead of the washing machine. So, and sometimes I just kind of go in circles because can't remember what I'm supposed to be doing. When I can't find something, or I'm in the kitchen or whatever room and can't remember what I was going to do, I get easily what do you call it?
Sidetracked.
I get sidetracked, yeah. So, and I can't remember what I was gonna do. So that's, like I said, frustrating.
He was a school teacher, so, in the West Indies, an English teacher on top of that. So he was very good at reading and writing, and stuff like that. And as time goes by now, he looks at things and he would look at it for a long, long time, staring at the same thing. And I know that he's just not understanding. He's trying to read, but nothing. There is nothing. I have to take care of all the bills. I have to take care of everything. Even the taxes that I was never used to doing, I have to do all of that.
The thinking in Lewy body is a little bit different than in some other kinds of dementia, some other kinds of brain illness. So the most common kind of dementia is this thing that's called Alzheimer's disease. And there are many flavors of Alzheimer's disease, but usually it's people who are unable to make new memories, as opposed to Lewy body, where the most common thing is slowed thinking, slowed processing. So if you give someone a little bit more time, you give someone a hint, a cue, a reminder, a calendar, they're often able to get that memory out or get that thing out. Maybe not 100%, maybe not right away, but usually the memory is in there. And that's one of the features that helps distinguish, not perfectly, but helps distinguish a disease like an Alzheimer's disease from a disease like Lewy body.
Dana was in one corner of the living room in the shadows by herself. Unlike her, she's normally up and bouncing about, and I went over and I took her hand and said, "What's happening? What's going on?" Not really any reply. She was deep in something. I had to dig that out. I said, just give me one word to tell me something about what's going on. And she looked up at me and this kind of lost feeling that I'd never seen before. And she said, "I'm not good for anything anymore." That was my lesson. That was my lesson. She was teaching me what I needed to know. And I realized that my job from then on was going to be about showing her about her worth and how she was valuable.
Maybe a couple of years ago, I would have a problem tripping every once in a while. I was always into sports, so I may run into a slight problem, but I never really, I never really thought they were connected, the disease with this kind of feeling. And it's gotten worse. I find that I have a very bad problem with heights, and that has become much worse. I don't know if there's any kind of relationship between the two, but I'm finding that I fall easily now. I trip over things. I went to the Met game the other night, and we were sitting like near the top, and I couldn't look down. I felt my legs were actually wobbling. And so I immediately left the stadium. That was the first time that I felt like I was losing control.
She'd be sitting back and she couldn't get up. So she'd always be kind of like leaning back. And, when she tried to get up, she just couldn't. It just was like something was holding her back. And she'd always talk about somebody's pushing me back. So that was common. That would happen quite frequently.
People with Lewy body often have difficulty with movement. Some people have movement or motor symptoms very, very early on in their disease, and some people have it only much later. And there are many different pieces. So some people have slowness of movement. They can move, their muscles are strong, but the movements are just slow. They take more effort. Some people, the muscles are very, very stiff, and it doesn't have to be all the time, but it can be some of the time that the muscles are stiff and it's hard to move the arms, it's hard to move the legs. Some people, the movement problems are more with walking. So you can have dizziness when you stand up, but even in addition to that, or separate from that, you can have balance issues. You can have walking issues. Some people shuffle their feet, meaning when their foot hits the ground, it kind of slides forward as you're trying to walk. And so you're sliding your foot on the ground. Some people have other changes in their walking. They can stoop over a little bit more, have a more of a hunched posture. There are a number of other kinds of changes in walking that we see. Some people start to have more falls or have a higher chance of having a fall than they did before. And then in addition to the slowed moving, decreased moving, stiffness in moving, worsening balance, some people also have extra movements. So tremor is quite common in Lewy body. There are a number of different types of tremor, often a little shaking of the hand. It could be one hand, it could be both hands. Some people, it's when the hand is resting in your lap. Some people, it's when you pick your hand up and try to bring it to your mouth to drink or eat something or do a button. And some people, it's when you reach out and try to push, say, an elevator button or a light switch. And by themselves, you don't necessarily have to treat these kind of movements if they really affect someone's function. If you can't do the stuff you need to do because of these movements, then we think about treating them. But by themselves, we don't tend to worry about them unless it bothers.
Early on, she hasn't had a lot of tremor, but a little tremor in her hands. But shuffling of her feet was an earlier sign, walking on her toes a little bit. She'll have sort of a stall, she'll get up to start to move and she can't get her feet like quite going. And so being able to help her get started is what's helpful. But the interesting thing is when she's in times of high anxiety and her difficult times when she's in some delusions, her body, she can get up and move and walk across the room with no problem. So it's really working aids and people that help you. It's a lot to explain how right now we have to sit her up, help her stand up, help her get walking. But at night, she might get up and get out of the bed and move. So you have to watch her. I mean, that's really a lot of fluctuation in what physically she can do. It's getting harder and harder and going down and down slowly. But I think for her, it's difficult because the times when she can go take a walk outside and do really well, and then she collapses and sleeps for quite a while and exhausted, she's getting frustrated that she feels more trapped in her body.
I noticed that Mark started to drag his feet a little, and he never walked like that before. He also, we would ski every year, and I noticed that he would fall a lot more than he had. And so now he is very stiff, and he shuffles. Doesn't help that he broke his hip, but he walks very slowly. And as time progresses, I know I see that it's very difficult for him to walk.
He woke up on Thursday and tried to get out of bed, and he was lurching from side to side, very unsteady on his feet. So much so that I would take his hands because he really could not walk a straight line, and he was weaving so badly from side to side. So what happened, I got him a drink of orange juice and I added water. I thought maybe he was dehydrated, and let him sit a while. It kind of disappeared, but came back later on in the afternoon. As a matter of fact, even from a standing position, he was almost like leaning so far over he nearly fell. He didn't actually fall, but it was very close to falling in the living room. My daughter happened to be there and she grabbed him. So that didn't happen until very recently.
It's getting harder for me to walk. I kind of lose my balance, and I'm trying to work on that on my own. And if I feel like I'm getting kind of wobbly, I'll just hang on to something and just focus on that. So, that's what I'm doing with that.
At the beginning, he didn't have any movement disorders that I was, aware of, because he was very active. He was a gardener. He took care of the house. He around this time of the year, he would have been out there planting for, his vegetables and stuff like that. Now he's not able to do those things. He doesn't have the motivation, number one. And number two, I don't think he has the strength to do it. And because he's started initially with the movement tremors in the hand, but it was not as distinct as it is now. At that time, he was able to eat with no problem and hold a cup or hold anything in his hands without shaking. But now, anything that he holds in his hand, it shakes. Sometimes I have to help him to eat. He doesn't, he's not proud about that. He lets me do it. He actually asked me to help him. So I think he's aware that it's hard for him because it shakes so much with the, to get his hand up to his mouth that, for me to get him to eat, I have to help him. And he sometimes he can do it by himself, but other times he has to be helped.
One of the symptoms that we can see with dementia with Lewy body, although we don't have to, is basically Parkinson's-like symptoms. And so that can involve a tremor, balance problems, stooped posture, change in handwriting, change in voice. And so these are all symptoms that we typically attribute to Parkinson's, but they can certainly be seen in dementia with Lewy body. The problem is the way we treat these symptoms in Parkinson's disease is to give them medications that boost dopamine. In dementia with Lewy body, we got to be very careful with doing that, because if we boost dopamine too much, it can actually worsen hallucinations. And so it's a fine balance between how bad are the physical symptoms and how bad are the hallucinations to see where do we really focus treatment on. Now, regardless, physical therapy is the most important component to treating the physical symptoms, because no matter what medications we use, it's been shown that physical therapy, especially with prolonged physical therapy, can reduce falls, reduce injury, and overall improve mobility.
But my caregiver, I'm so glad I have a caregiver 24/7 in the house. Because lately I've fallen and some pretty bad falls. I've been blessed. I got bruises out of them, and that's all I've gotten. The one time I was exceptionally really glad she was here, I fell through our glass doors in the shower. Pushed the doors against the wall. Thank God they didn't break. I didn't get cut. But my wife was here to help pick me up and get me out of there, because I don't believe, as a person with Lewy, as weak as I've gotten, I could have gotten myself out of there. I mean, the other night, my legs get so weak, we have a travel wheelchair. And I was standing at the sink for a while, and I could not move my legs. It gave out, and she had to bring the chair in and put me in the wheelchair to wheel me back to the living area. And that's a new symptom that's happened quite frequently.
At nights, he trashed around a lot, and I thought he was just having crazy dreams, and sometimes I would wake him up and I say, what is going on? And he said, oh, a dog was coming after me, or a snake was coming after me. So and this is like, you have to understand, we grew up in the West Indies and dogs were not in-house. They were out in the yard. So if you were passing by, they would start barking at you or something like that. So that's something that I could identify with, and I knew what he was talking about. Snakes, we didn't have a lot of snakes, but I don't know, whatever, he dreamt about that. But I did not associate that with any kind of illness whatsoever, because I just didn't know, you know. At times, sometimes I used to have to sleep further away from him or try to catch his arm if he, you know, in the night when he's trashing, because I'm afraid that he's going to hit me or something like that. And when I tell him about it, he doesn't recall it. And when the neurologist asked me that question, I said, oh, it doesn't happen that much now, but a couple of years ago, it's been happening. So he said to me, well, that's just to let you know that that's the beginning of, you know, the Lewy body dementia.
Because my father's REM sleep issues, he has, I think he broke my mother's rib at one point. I know that when my son was in Florida visiting, my dad had put his head through the wall and wound up in the emergency room. But they sleep in separate rooms because my mom is scared to sleep with him. So,
but then the issue also becomes that she stays up all night listening for him in the other room.
Prior to my husband having the REM sleep disorder, he did have a lot of restless leg syndrome, where he thought he was getting these severe cramps, let's say, in his legs. And so he would ask his doctor for prescriptions for quinine pills. He thought because he was an avid runner that this was just like cramping, but it really was like restless leg. And then the restless leg moved on to the REM sleep disorder, where he would actually get quite violent in his dreams with flailing and, you know, thinking he was running, and then he would run, you know, start running in his dream and run out of the bed and fall down and, you know, hurt himself. So that is how the REM sort of progressed. He would be speaking out in his dreams. He would be actually acting out his dream.
The sleep disorder was a really big problem till they put him on all the medication, because he would kick during the night. He would swing his arms and hit me, and talk all the time out loud, sometimes yelling and everything. But then when they put him on the medications, he still talks and he moves his legs sometimes, and sometimes he'll move his arms. He's a sign language interpreter, so sometimes he'll start signing in the middle of the night with his arms, but it hasn't been too bad.
He would thrash in his sleep. I sometimes would get punched, or his arm would flail and the night table lamp would be knocked on the floor. It was very dramatic. It didn't always happen, but it happened from time to time.
Also, one time he would also wake up super early, like as he was like, it was almost like he was like running in a nightmare, you know. He would wake up from the bedroom. He would wake up, he would run out the door and just sprint outside, like right after he had like a nightmare. And I didn't experience this as much as my mom did, but she told me a lot about it. And he would also just play out his dreams as a reality. He like once when I was in 7th grade, he woke up in the middle of the night. It was probably like 2 or 3 a.m. and he just like, he ran into my door, he like slammed it, and he just slammed into my door and opened the door and just like came into my room screaming. And after that, that's when I got locks on my door. So, yeah.
Ultimately, he would have these dreams and believe them, and he would hit me in his sleep, believing that I did something. And I remember once he had a dream that I was having an affair with a man, and he woke up and he punched me so hard. It was very scary. But that's, a lot of it I block out because it was just so difficult to deal with. But that's what I remember.
Mom's sleeping. She's not a big kicker and mover in bed, a little bit with her legs, but boy, will she talk when she's dreaming. She will talk up a storm when she's dreaming. She will even sometimes scream out in the night while she's sleeping. So nights when she's much more disturbed, she'll be talking much more. So the challenge is distinguishing between, okay, are you saying you need to get up and go to the bathroom and you're awake, or are you just talking in your sleep? So usually she has to get up once or twice, sometimes 3 times to go to the bathroom, but getting her up while she's in that dream state, that's no good. So having aides who are helpful with me to distinguish that. When she's snoring, I know she's sleeping well. So I love to hear her snoring.
Sleep issues are very common in Lewy body, and there are a number of sleep issues. So one of the most common things for people who have Lewy body disease is to act out their dreams, something called REM sleep behavior disorder, or RBD, or there are other names for it. And in this, most people, when you fall asleep, your muscles in your brain have to disconnect. Otherwise, when you're dreaming, you would hurt yourself. People with Lewy body and some other related conditions are more likely to maintain that link between their brain and their muscles when they're sleeping. And so they act out their dreams, punching, kicking, screaming, moving in the middle of the night. Now, many people move a little bit in the night. They'll mumble, they'll talk a little bit. This is separate. This is usually to the point where some bed partner or someone else would actually be able to tell you about the content of the dream. They would understand what that person, or have at least an idea of what that person is dreaming about because of these movements. Now, they can be violent. Sometimes people dream that they're in a fight or doing something like that. So it can really affect the bed partner. And also, people can fall out of bed in the middle of the night. They can knock into things by the bedside. And so there are a number of different ways that we can try to help with that, both with different kinds of medication, but also just making the area around the bed a little bit safer. And that's a very, very common feature of Lewy body that can actually happen years or sometimes even decades before any of the other symptoms. And the other very, very common kind of sleeping problem is an increased need for sleep. People just get very, very tired and sleepy. And it could be nighttime or daytime. So some people are just sleeping more and more hours more during the day and at night than they used to. Then some of the other symptoms of Lewy body can sometimes impact people's sleep. So some people who have hallucinations or delusions, in other words, seeing things, hearing things, thinking things that don't match with reality, sometimes those interrupt people's sleep, and that can be very disruptive to the patient or to the caregiver. Sometimes when people have significant problems with their thinking, they might not understand daytime, nighttime. They might not remember what their schedule is. For people who are in a more advanced stage of illness and they have problems with incontinence, peeing on themselves or soiling themselves, that can disrupt sleep. So as the disease progresses, people can have different kinds of problems with the sleep. And many of these have either more direct treatments, more specific treatments, or can have indirect treatments, things that we can do to help the quality of life of both the person with Lewy body and also the caregiver.
Early on in dementia with Lewy bodies, we can see various types of hallucinations, and they can be grouped into multiple different categories. The most common one is probably what's called an illusion, where somebody might see a pile of clothes, for example, and think that's a dog or something similar. So in that respect, they have a physical object that's already there, but their brain mistakes it for something else. So that's what we call an illusion. Versus a well-formed hallucination where you might see somebody or something, whereas there's nothing there at all. So the common thing that I hear is that somebody might say, oh, I saw a dog walk by when there's no dog there. Or they might say, I saw, my sister or somebody sitting next to me when that person was not only not there, but may also be deceased or very far away. And then you can have a delusion, which is different from the first two in the sense that a delusion is just a fixed formed belief that's not true. But it doesn't necessarily have to be something that they see. So they could be in their mind, they could be 100% certain that they went to the store yesterday, or that their spouse is having an affair, or that their children are injured, or something else, where in their mind it's 100% reality. And how that's different than a hallucination is that they're not actually seeing that person there. It's just a thought process that they have. But in reality, these are all kind of a spectrum of the same problem, but they're just variations of that same issue. And then you can throw in something that's very specific called capgras, where it's kind of a mix of a hallucination and delusion, where you mistake a family member for somebody that doesn't exist, or they may confuse who their family member is. And typically that involves faces in particular, where they might see a spouse and think that that spouse is not actually their spouse, and they may not recognize them at all. But if they hear their voice, or if they get cues, they can oftentimes reorient themselves and realize who that person is. But they can very easily mistake that person for someone that they don't even recognize, which can be very, very difficult for family to hear and to deal with.
When I wake up in the morning and I look at a wall or the ceiling, there are hieroglyphics all over the ceilings and the walls, okay? They're not really hieroglyphics, but they are totally unlike one another, and there must be 1,000 symbols in the areas that I just mentioned. And I have no clue. I don't know if that's considered a hallucination, what I mentioned before, or not, but it's really feelings that I've never experienced before.
Nikki had auditory hallucinations, and those were the first really prevalent ones. And then came the visual hallucinations. Like a lot of people, he saw children and small animals, and it was very sweet in the beginning. And then as the hallucinations progressed, they got a little bit stronger and not so sweet. I remember an occasion where he woke from a dream and said that he was seeing squirrels, and the squirrels were running all around the apartment, and they were invading the bed, and he needed to go out and buy a $17,000 bed because the squirrels had taken over. And then he got up to check to see in the living room, were the squirrels there? Were they destroying things? And so it took on different forms, benign and then more aggressive forms. There was never any violence, happily, and I know in some cases there is. With Nikki, there was no violence. There was anger, and it would come at me in the form of mistrust, but or you don't understand, or sometimes you're the crazy one. That transference, but all of it came back to ultimately a sweet and docile grounding, which I think you can bring on by deflecting. Very often you can't stop it. You just have to deflect it when it comes at you.
Hallucinations were evident from the beginning. We had a lot, particularly at night, in regard to small animals in the bed. And he would stamp them with his feet or hit them with his hand. I had to be very careful. I always had a bolster pillow between us so I wouldn't get belted in his hallucinatory state, because these were true hallucinations and they made him very scared, very anxiety provoking. And there were animals, there were bad people also. And there could be more than one bad person. There could be several bad people. And he mentioned more than once that someone was trying to kill him, that they would hurt. So I tried to reassure him that he was safe when he woke, when he became more calm, that he was safe and he was loved and nobody would hurt him because I had locked the door and nobody could get in. And the doorman downstairs wasn't letting anybody in. They weren't permitted upstairs. So he was safe in his apartment, and I was with him all the time. But they sure were a difficult time for him. He has hallucinations still, and now it could be daytime, nighttime, anytime. And he often comes and takes my hand and says, "Come with me, come with me. I want to show you this." And so he takes me into our bedroom, and he says, look on the bed. And I go over and I fluff the bed, and I tell him what one of our colleagues said. "I'm not able to see what you see. I'm not able to see that. So let me fix the bed and make sure there's nothing there, but I'm not able to see anything." And that satisfies him for a time.
So the hallucinations, delusions, I guess I first want to say that people need to know that Lewy body dementia, once you see one symptom, it doesn't mean that symptom's going to hang around. So it's going to shock you one day, and then it may disappear, and then it may come back. And so there's always this almost vigilance as a caregiver of wondering when will that come back, or will it come back, or what is this about? And the first hallucination was when he was dramatically diagnosed with Lewy body because we didn't know he had bronchitis, and he spiked a fever, and just as any new impingement like a fever, a head cold, too much heat outdoors, too much cold when you're walking outdoors can exacerbate Parkinson's symptoms. Suddenly, because he was ill with the bronchitis, he suddenly developed all these Lewy body symptoms. And one of them was to look down our hallway, which just led to our bedrooms, a flat hallway, and to ask me, "When did you put steps in the hallway?" And so that was the first visual hallucination. For Paul, those came and went, and they weren't that dramatic for a number of years. What was particularly dramatic was 2 years into the disease, and I'm dating that from the diagnosis. He suddenly he thought there were two of me. And the way I learned about it, he said to me, "You walk down the road to see your friend Anne, and the other Pamela comes back." And that was one of the most difficult moments of dealing with this disease, because he was so confused and he was frightened. And I always say to people, and it's kind of funny, and I think I'm trying to ease the discomfort, is that I expected to see Rod Serling standing in the corner of my room smoking a cigarette, saying that this woman thinks she's in her home, but she's really in the Twilight Zone, because it feels that eerie to have someone you love, your husband who's known you all these years, look at you with the face that he turns to a stranger. And he would say to me, "How do I know you're who you say you are? If you go with me to see our friends Steve and Linda, will they know you? Do they know who you are?" And this went on and on. And I'm lucky in that he never got belligerent. Only once did he get belligerent and not trust who I said I was. So he would believe me, even though he didn't understand how he could really know that I was his wife.
Yeah, I used to be very embarrassed by hallucinations. That first one that I had, which was a dragon out of the computer, that happened a couple of times. And I didn't even tell anybody about it until I was, we were discussing the possibility of Lewy body. But I had others where they were often in the peripheral of my vision. So typically to the right side. And I would often see a woman standing there. And it's just off in the distance. Either she's behind me or she's just in the other room. And not much going on, but very clear, right? Then I had mice that I thought I was seeing. And it got to the point where once I asked Tae Young, my husband, if he could get some mouse traps, because I wanted to put mouse traps around the house. And his response was, "We don't have mice, Mike. There's no mice. We get the house treated. There's no mice." And I said, "I could swear I've seen them." And then what caused me to stop driving is I was driving one day, and it was just here near the house. We live on the corner, and I was about to turn into our street, and I sat there at the turn for a prolonged period of time because I thought I was waiting for a big truck to turn. And this big, dark truck, when I realized there was no truck there, because I just intellectually said, that truck's not there. That's not real. And as I turned the corner, it was the shadow of the hedges onto the street from the afternoon sun. And that's very classic for me. It's usually a shadow, or I'll see a rock while we're driving and I'll ask Tay to slow down because I think that's a turtle, or I'll think it's a little dog or something by the side of the road. And it's usually something that I'm making a mistake for.
Whenever the caregivers were here and I was here alone with them, sometimes I would just come out in the kitchen to get some food or whatever, and he would like come up to me and say like, "These people are trying to kill us, like be careful, like we're not safe," and I had to like reassure him. But honestly, after that, I just went back into my room. I kind of left it for the caregivers to deal with.
He always would get scared that we weren't safe, and he would ask if we could call the police because he is afraid someone's trying to come in, someone's trying to steal his money, someone's trying to hurt us. And I would actually use the building phone and call the doorman and reassure him that the doormen are taking care of us and that they're keeping us safe, and that reassured him a lot. But yeah, he was always thinking about someone trying to hurt us, someone trying to rob us, someone trying to kill us. And luckily, some of the doormen would come upstairs and tell him that we're safe, and that was a lot of help.
So her aides told me that she's always looking, and she'd say, "Do you see that person over there?" And at first, the aide would say, "No, I don't see anybody." And but she's right there. So it's very obvious hallucinations. The aide learned not to say no after a while and just say, and I told her, you say, "Well, you have special powers. You can see her. I can't see her." But not to argue about those. So, and she definitely does now. I mean, she's always looking and saying, waving to somebody or saying, "Who's that?" And there's nobody there. I got some new doctors for her who were willing to explore other this is not just Alzheimer's or, whatever, but, he asked her point blank, it's like, "Do you see like people or animals and she goes, "Oh yeah." There's all these people sitting, squatting along the wall. They're all poor. I mean, they're all poor. They're all like waiting for food. They were very, it was very detailed descriptions of what she's seeing. Like, she never mentioned that to me, but she was just like, oh yeah, I see that. And he's like, how often? Oh, a lot. Like, where did this come from?
One of the early ones that has stayed with her for a long time is there's this little boy, Stuart. And I've never figured out where the name Stuart come from or what, but early on, Stuart was climbing the trees outside and he fell and he got hurt and she was upset about Stuart, or she's always worried whether Stuart is going to make it home. If it's raining out, he needs a coat or he's cold. Or so early on, I always say, oh no, there's no Stuart, there's no. Now we're at the place where I can say, oh, Stuart's gone home, he's okay. You know, we find a way to help her work through it. The other day, when she's at nighttime, when she's in bed, we have a pillow under her knees and a pillow under her heels so they don't rub so much. And she tends to think lately that there are kids who get in bed with her. Sometimes she'll say they're only eyes, but she'll say, no, Stuart's in the bed. So I tell all the aides, when you go help her to go to the bathroom, don't throw the covers or the pillows, because she thinks you're throwing the babies and you're throwing kids, and she gets so upset. So you got to move it carefully. Make sure. The other day I sat on the side of the bed and she nearly had a fit because I was sitting on Stuart. So it's interesting that some of those hallucinations and delusions hang on. They may shift or change. The other day, Stuart was sick. He needed to go to the doctor. Well, her ear was bothering her and she needed to go to the doctor. So sometimes what she's saying about her hallucinations is about what she needs is around too. Not always, but sometimes.
We were coming back from dinner or something, and we were in the hallway. And again, I had my arm on his back for support. And I said to him, because they used to have they had hallways they were like spokes from a round center hallway with a center light fixture and then like a large drum table with a flower arrangement. And I said to Jerry, do you see those children dancing around the table? They're like little table height children dancing. And Jerry kind of looked at me and he said, no. And I said, oh, okay, good. That was the only time I ever mentioned anything to him, because I thought it was so odd, because it was like for the first time, it seemed like there was color, not anything defined, not like I could think, oh, well, the little girls were wearing pink and the boys were wearing red, or it wasn't, but it was color of some kind. And so I thought, okay, now I know, shut up. Don't say anything else.
The autonomic nervous system is a component of our body that regulates temperature, blood pressure, heart rate, and various other things. And what we see in dementia with Lewy bodies is that you can have a large fluctuation in heart rate and blood pressure. So it could be high 1 second, low the next. And that tends to lead to a lot of problems, because if it's high, you go see a cardiologist or a primary care doctor, and they'll give you medications to lower the blood pressure. But then that might cause a significantly lower blood pressure than intended. So it's very important to have a cardiologist that understands these fluctuations, and that the patient and the family has blood pressure cuffs at home and checks the blood pressure and heart rate on a regular basis to make sure that it's not dropping too low and not going too high. Because if it goes too low, you can pass out. If it goes too high, you can have a stroke. So you got to be very, very careful with managing the medications that we use for blood pressure to not overdo it. And a lot of times patients will just come off all their blood pressure medication because they really don't need it at this point, because the blood pressure tends to be lower than higher.
It took me some time to learn how to say autonomic system. And I just think of auto, right? Things that happen in the body without any conscious thought. And that's what this system is. And things like keeping temperature, right? Homeostasis, they call it. Keeping a balanced temperature in your body. Feeling dizzy when you sit and stand is a change in your blood pressure. at physical therapy, I can actually do a workout. They have a sled that I push with weights on it, and I go back and forth in the gym with it. And at the end of it, they sat me down and took my blood pressure. And instead of going up, it went down. And that would be the autonomic system not working right. Exercise, exertion should make blood pressure go up, but mine goes down. When I stand, I now have a habit of standing for a minute before I try walking, just because I can be lightheaded or dizzy. My blood pressure changes dramatically when I stand. Another thing with the autonomic system is I can be sitting in a room, like last night it got cold, and I'm sitting there sweltering, and my system is telling me I'm hot, and I actually feel a little perspiration or whatever, and I keep checking to see if I'm sweating, and I'm not really sweating. So my body's telling me I'm hot, but I'm actually cold because the room is cold because we didn't have the heat on. Then in the middle of the night, I'm freezing. So I can go from cold to hot. This can also happen with digestion and use of the bathroom. My first experience was just having to urinate many times during the day regularly, and then getting up a lot at night to urinate. That's how it began. And then I can go 5, 6, 7 days with diarrhea several times a day. And I'll take the diarrhea pills or whatever, and they don't do anything. And then abruptly I'll have that end. So whether your stool is diuretic or towards normal, there's just no telling.
Her autonomic system was just it was just chaos. I mean, I noticed that when I first got there, it was like she'd be hot and cold and constantly changing, trying to adjust the temperature. She'd be sweating. But her blood pressure definitely had a mind of its own. She normally had low blood pressure, but every once in a while it'd go up. And so we were going to the cardiac doctor. Constipation was constant thing. Her friends even mentioned that she'd been talking about that for years, and to the point where they're telling her, stop it. We don't want to hear about it anymore. Especially, it's usually over lunch. But no, anything that the autonomic system controls was going haywire with her. She just couldn't understand why this system was that, why is she feeling like this? Why is she feeling like that? And it just like, it was just always like, wow, because that's something that you don't, I knew it was part of her autonomic system. So yeah, that was haywire.
Most every day. And it just kind of blows my husband's mind because especially if we're in the car, I'll say, oh, you need to turn the air conditioning on. And then I'll say, it's too cold in here. We need to put the heater on. It's not every day. It's not all day. It's intermittent, but it does happen. And I have had more problems with constipation. It's always been an issue in my life, but it got worse. But my family doctor put me on a medication, and it's odd because the prescription doesn't really give a name. It just says stimulant, and it's not like a laxative, but it keeps things moving. So I'm still not back to where I was at my best, but I'm further ahead than I was before the medication. So, but that definitely has been an issue for me.
At nights now, he doesn't want to get up to go to the bathroom. Even if I call him, I wake him up, I say, come, let's go to the bathroom, I'll go with you. No, I don't want to go, I don't feel like it. But then in a few seconds later, he would wet the bed or wet, he has pull-ups, so he doesn't have, the bed doesn't necessarily get wet, but he is wet. He doesn't have any problems with incontinence of feces, just the urine. So during the day, he's pretty good. If we have to go out, I will have him put a pamper on, especially if we're going to be going somewhere for a few hours. And I'm not sure if there'll be a bathroom available, so I'll make sure that he puts one on. At the beginning, he would give me problems. He wouldn't want to wear it. No, he doesn't, because I guess he realizes that it is helpful to him. Maybe, I don't know if he realizes that, but he doesn't give me a problem.
So the autonomic system is a crazy one to have to deal with Lewy body, because it really can mask itself as other things. Like mom's nose will run all the time. And at night, she'll cough a lot because of extra saliva. So particularly through pandemic, when they say, oh, do you have a runny nose? Are you coughing? It's like, yes, mom's doing that, but I know it's not COVID, it's Lewy body. So knowing that it's related to the systems not working well. I'll never forget the first time when somebody in the support group said, oh, yes, the nose runs all the time. That's good. Now I know Lewy body. The constipation is the hardest thing, though, I think. And mom talks about having had that for a long time in her life. So she really didn't equate it to Lewy body, but I think it probably was one of the earlier signs as well in her body. And so it's really all the time trying to find the balance between giving her Maalox, not giving her Maalox. If her stool is too soft, then she doesn't have control and can't make it to the bathroom. And then she's upset because she has to be cleaned up. But if her stool is too hard, then she can get blocked up. We had a hospital stay for a bowel impactment, and going in the emergency people, I kept saying, I know her bowel's impacted. Well, when was her last bowel movement? I said, she had a little bit yesterday, but it was runny. And I know how much she said, please check for her bowel impactment. When they finally did the ultrasound, they said, oh yeah, she has a bowel impactment. So coming home from the hospital, she had a lot of incontinence after that, and getting that rebalanced, really a lot out of her. So those systems, trying to keep them balanced, it's not easy. It's kind of a game to try to balance it out. But knowing that it's part of what's going on can help.
He was always cold. And his neurologist explained to me that it's like an oven. When you open the oven door, his capillaries are open, so the heat is escaping. And that was, I had no idea. And it makes sense to me now when I see people. In the middle of a sweltering day in the summer with jackets on, I know that they have dementia, because that is, again, something I learned, a huge sign. He is always cold. Yes, as the disease has progressed, there is a lot of constipation. I've noticed that, and the constipation would also cause a lot of agitation. He would get very angry, and his violence at times, in retrospect, was exacerbated by his discomfort, and it made sense to me later on that was possibly why he would get aggressive, because he couldn't articulate that he was constipated and uncomfortable.
Luckily, I knew before all this what the autonomic nervous system is, which is the part of the nervous system that controls all the things we don't think about. such as our breathing, our temperature, our ability to digest food, our ability to eliminate toxins, our ability to sweat and go to the bathroom, all of those things, our blood pressure. And we found that Lewy body dementia affected just about everything. Even when he could still go for a nice walk around the block with his walker, we could go out on the most pleasant spring day. And of course, he walked extremely slowly, so he wasn't working up a sweat. And he would be home and he would be soaking wet with sweat, reacting as if it was 110 degrees outside. And really, his system just was dysregulated. Or he would get very cold at other times. He often felt very dizzy when he stood up. And so the neurologist actually instructed me to let him eat salty foods, potato chips, all of that, because his blood pressure was low and would plummet when he stood up. And digestion was always a problem. Constipation is a huge issue to deal with for years with this disease. And I know it's an issue for people with Parkinson's, so it is absolutely an issue for people with Lewy body dementia.
One of the really downsides to Lewy body dementia is the incontinence and particularly the bowel syndrome, which is either very loose bowels or constipation. In Nikki's case, there was a fear of bowel movements that couldn't be controlled. And what it caused initially is Nikki to actually stop eating. He didn't want to eat because he was afraid that that would trigger something. When I finally was able to convince him that no, that was not the case, this was the disease that was going to actually have this happen, whether or not he ate. We were careful about the diet, but he was then convinced to eat, and everything was fine as far as it went. It still was happening. There were still bowel movements that were uncontrollable. What ultimately our doctor came up with, which did work, was Imodium every other day, which seemed to then control the bowel movements to a more or less manageable degree. But that was a real issue, and it's something people don't like to talk about, but it's there.
I have problems with constipation. It happens often. I'm cold often, very, very often, where my hands are like ice. And my cardiologist the other day said that's nothing to be concerned about, but I am constantly going to the thermostat. My wife is going to the thermostat. She turns it one way, I turn it the other way. And so there's definitely temperature changes within myself, especially in the winter. It's very, very difficult. The cold weather is hard for me.
People with Lewy body disease and Parkinson's can get autonomic dysfunction. This means part of their nerve system may not work properly. And certain muscles, whether it's bladder muscles or muscles in their colon or muscles in their esophagus and swallowing, all can be affected. So there's a lot of constipation. And constipation can also be caused by drugs they're taking. So the medications can cause constipation, especially patients who have those Parkinson's features where they may be using levodopa type drugs can cause constipation. Some of the drugs we use for the behavioral symptoms may cause GI side effects. In general, for any patient with constipation, number one, they need to drink fluids, water. They need to drink water. They don't want to drink water because then they have to urinate frequently. Water, fiber. So fruits, vegetables, prune juice. I'm a big advocate of prune juice. things like flaxseed and bran. To be careful about using fiber, even things like fiber like Miralax type fiber, if you're not drinking fluids, because if you just take fiber and you're not drinking the water, you make cement. So they need to drink fluids. And then there are all kinds of over-the-counter laxatives, stool softeners that can be tried. Again, it's going to be trial and error, but they should talk to their healthcare provider about figuring out which is the best one for them to try initially. But one of my suggestions is you have to give everything a try. Don't say, well, I took this Monday, it didn't work, so now I'm going to try a different one on Tuesday. And that didn't work, so on Wednesday, I'm going to try a different medication. I just had this experience with a patient, not with Lewy body, where it didn't work fast enough for him, so he kept going from one medication to the other until he had the opposite effect. So stick with it. Give things time to work. Activity will also help, being physical. So as people become more sedentary, they're going to be constipated also. You need to move things around and move things through. So incontinence, another problem. So bladder muscle dysfunction and the incontinence. Problem is that a lot of the medications that are used for incontinence have side effects as well, which can include sedation and confusion. So those have to be weighed as well, right? So everything is a risk-benefit ratio, and what I like to call shared decision-making, where you talk about, well, yes, we can try to treat this symptom you're having with this drug, but you might get this side effect. So be aware, let us know. So it's weighing the risks and benefits.
Fluctuations are very much part of Lewy body dementia. It's interesting to note that in our case, and I say our because we were in this together, in our case, it had no pattern to it. It would come and go. Sometimes he could go for days with being 100% Nikki, and then sometimes it was hour to hour. It was a different person. As it progressed, as the disease progressed, the anger issues became more prevalent. And there were moments when it was really just a ferocious lashing out. And then he would catch himself and say, "I'm so sorry." And my response to that was, "It's okay. It's the disease speaking. It's not you." And that's a very hard thing to take with this disease. Most diseases are linearly progressive. They just follow a pattern and go downhill, and they keep going downhill. This one is in and out all of the time. And because of that, it takes its emotional toll, not only on the person who's going through it, but on the caregiver. There's just no question about it. It hurts when somebody comes at you and says, "I don't trust you." I mean, after years and years and years of nothing but trust, when that comes at you, it's like, my God, it's a lightning bolt. And then in your saner moments, after you take a deep breath or do some yoga exercises, you realize that this is not your loved one speaking. It's a third party invading.
I wake up in the morning and basically I have my breakfast. There are some days where I feel like I'm in a complete fog, where I'm totally confused and very anxious. Simple things make me very, very anxious. We babysit 5 days a week for my grandchild. In addition to that, I do word games. I try to keep myself as busy as possible because I think about this all the time. I think about it all the time, but I don't talk about it very much. And I was holding back information from my wife and daughters, and they were very unhappy that I was doing that. So I have been a good boy, and I've been including them in what I'm going through and how I could best go forth with this. Today, for example, maybe 3 hours ago, I was in a complete fog. I get a runny nose. As soon as I get a runny nose, I know it's starting. And at that particular point, I lose focus. I become very inattentive. I can't do basic tasks. I'm really, really in a fog. And then it disappears. Now, like right now, I'm doing much better. But if you had seen me 2-3 hours ago, I was a different kind of a person.
While it gradually fluctuates by day or week or month, sometimes his cognition is better, sometimes it's worse. I find that throughout each individual day, his cognition changes.
Right. You can have a conversation, or I could have a conversation, they could be different how he was.
Right. And I think a lot of it has to do with how fatigued he is. So while he really pulls it together, maybe for a lunch or to be with people, even though sometimes he's more quiet than we're used to, those 2 hours will be the time where he'll, show off and be engaged or try and add value to the conversation.
He'll use all the gas he's got in his tank for that one thing.
And then
he's running on empty after that.
Right. And depending on how his rest was, what his anxiety level is, the next day, it might be a little better. It might be a little worse. Sometimes we find that there are better weeks than others.
I think those are becoming fewer.
Exactly.
Fewer and far between.
Exactly. We're finding that instead of the big dips, and the raises in his cognition, that it's more becoming gradually lower, maybe a little bit, bit higher.
Right.
Internal or external, a stressor, a new environment, a new caregiver, right? A new medication may cause them to fluctuate. Sometimes we don't even know why we see these fluctuations. And that can be very difficult for a caregiver as well, who is, has certain expectations, and then there's this decline that they have to deal with. It's like expect the unexpected.
I have bad days, and I have bad hours, and I have bad minutes, and they come at me at their own will. So I'm just kind of trying to remember that there's a bigger reality, and I don't know. It's you can't be prepared for it all the time. It's just too erratic. I've known people who've talked about how they're fighting a battle, like they let themselves relax a little bit. They'll enter into the crazy story, and they'll have a part, and they'll play their part, and they'll be, running away or whatever their character in the movie would be doing. That's what they're doing in reality. And I think that scares me. That scares me, like it's kind of dangerous. Because you're running down the street chasing a ghost, and no one else knows what the hell is going on. And so you have to keep one foot in reality. It looks like that eventually gets lost.
His behavior is so brittle that it as I said, resembles the Dow Jones Industrial Index. It's jagged, it's up one day, down the next. And that went on for quite a few months. More recently, it's kind of plateaued to a lower level. And I see fewer peaks, fewer ups, fewer good times or good thoughts or good conversation or good anything. It's sort of plateau, and the lower part of the graph would be just edging lower, lower, lower. So That's the part we're on. Our conversations are very difficult. He has such blockages from the Lewy body disease that sentences are impossible. And if he manages a short sentence, it has words in it that you just don't understand. They're made up words. They may be a piece of one word and a piece of another word, but they make no sense. And I can't always tell what he's saying, but and that's difficult.
This is the most disturbing thing, or the most difficult thing to deal with, because literally from hour to hour, certainly day to day, you could be a completely different person. You could wake up one day feeling great. Wow, I feel wonderful. I'm going to go out and take the world on. Just unfortunately. And the next day, you can't get out of bed. You don't want to even put your clothes on. And it could be day to day. I'm here talking now. I feel fairly good, but we could end this conversation. I could go into the other room and I could start to go downhill and not feel so good. And the fluctuations are up and down. And that is a very disturbing thing, because you don't really know what to expect. You know, most people get up and they know they're going to work, they're doing this. But when you don't know how you're going to feel from really moment to moment, day to day, and you know it's related to this brain problem, it's really not you having a mood problem, you realize that you're limited. And we have to plan our lives, because when I wake up, if we had planned to do something and I'm in that, I'll call it the mood, which is very difficult to describe, but it's a mood where you just don't care to do anything. You just don't care to do it. And that could fluctuate out and that could come in. So in your life, you're very much on a roller coaster. And that can be hard to deal with if you don't sort of accept it and talk to your doctors and understand that that's not you. It's the disease that's doing that to you. And you have to learn how to deal with it when it hits you and recognize it, and don't let it scare you, because it actually could scare you, because your mental state changes, your mood changes, and you don't see any reason for it. And then you realize, well, it's your brain disease.
I think one of the very hardest things about caregiving someone you love who has Lewy body dementia are the fluctuations, because you don't know, not only from one day to the next, what you're going to encounter. Sometimes it's 1 hour to the next, what you're going to encounter. Paul could be pretty with it and then lie down and take a nap and get up, and an hour later and be completely delusional and hallucinating, or vice versa. And it's very, very traumatizing to the caregiver to live that way, because you become hypervigilant. You wonder what's going to happen. You're constantly trying to anticipate, and you can't anticipate what you're going to encounter. So I would say, and the fluctuations can be physical, where he could barely move and walk, and it was very difficult. He went sometimes for months with just needing to use a walker and suddenly not needing the walker. This was early on, 5 years ago. He could go for a month without needing the walker, and suddenly he needed it again because he was feeling the wooziness, the dizziness. So the physical symptoms fluctuate tremendously, and the cognition and delusions really do fluctuate a lot.
Every morning I wake up, I say, okay, let's see what day it's going to be like today, because his mood fluctuates frequently. You know, we will be sitting at one time and we'll be enjoying a movie, or I think he's enjoying. I think sometimes he follows on with the movies because he makes jokes about what he's seeing, or he makes comments about what he's seeing, you know. But in the next few minutes, he might get up and go to the kitchen, and I say to him, "Oh, what are you doing?" And he flips, you know, just like that. You know, just like he doesn't know what it is I'm talking about, or you know, and the thing that happens is whenever he doesn't understand or he cannot express himself, he curses, you know, and this is an outlet for him. And I said to him, "Why do you always curse?" I said, you know, you have such a good diction. Why do you always use those same words? It's like you don't know any other words. And he would say to me, "Oh, you know more than me, right?" I said, "No, I don't know more than you, but I use the ones that I know," you know, are not offensive. But he is always very, very thankful for whatever I do. He's always courteous. I help him in the shower. He thanked me so much. You know, I give him his meals and he thanked me so much. But like 5 minutes later or 2 minutes later, he said, "You might say that you've never done anything for me in your life, you know, or things like that." So and you just never know from moment to moment what's coming next.
Fluctuations. They have pretty big, significant changes in their thinking and their awareness and their ability to be awake and alert. And, you know, everyone has good days, bad days. This is a little bit different. This isn't, "Oh, I was a little bit better today, a little bit more tired yesterday. Oh, I remember to take my medicine, so I'm a little bit perkier." This is a lot more profound. This is without a clear cause. It could be minute to minute in some people. It could be hour to hour. It could be day to day. And it's variable. So it's not like, "Oh, well, every evening my loved one starts getting more confused and getting more restless and a little bit irritable," which is something that's called sundowning that could be common across many, many different kinds of dementias or brain diseases. This is without a pattern. So it's not necessarily a particular time of day or related to anything else. And it's also of various degrees. Some people it's relatively mild or infrequent. Some people it's profound enough that, you know, doctors wonder, "Oh, is this person having a seizure, a stroke, something else going on?" And so depending on how often, how much, how bad, it can actually be quite frightening and can lead to other medical care, which perhaps at first it should. After the 5th, 6th time we don't see anything, then perhaps not. Other people, for caregivers, it can be very frustrating. And "What do you mean? When the doctor saw you, you looked great, and then 20 minutes later you look horrible. And if only the doctor saw you when you looked like you do now, or if only my other family members saw you the way that you look now, but you pulled it together." And the caregiver pulls their hair out. And that's unfortunately part of the disease, that people are just different, and people's ability to think and to process and to interact just changes.
You know, I could have an hour or two like today and I'd be absolutely fine. And within half an hour, I could be somewhere else. Within another hour, I'd be, you know, like tonight, around about 6 o'clock, 7 o'clock, I start to get restless nearly every night, not, you know, almost every night. Within the hour, then I'm asking to go home. How many times have we heard that? Within the people asked to go home. You know, so much we could do, you know, by simplifying it. And as a person living with dementia, I like to think that when I has to go home, do I mean my spiritual home? No, I am not that way inclined, you know. Do I mean my home of my birth? No, that's 600 miles away, and I live in a beautiful part of the country now, which I would never leave. Which is Devon in UK, so I would never leave it. So what do I mean when I say I want to go home? When I want to go home is when Elaine comes over to me and consoles me and puts a hand on mine, tells me I'm safe. I need to know I'm safe. I need to know that in that particular time, in that day, I'm going to be okay.
Behavioral issues are very common in people with Lewy body. Some of these behavioral issues are because there are changes in the brain that regulate or help us process how we're feeling and process how we react and how we understand the rest of the world. And some of them are kind of secondary. So the person who doesn't remember or understand some of what's going on may have a normal behavioral reaction to something that is abnormal. So as an example, a delusion, some people say, oh, well, my wallet was stolen. Well, if you left your wallet on a table and you went away, you came back a minute later and the wallet was gone, you'd think someone stole it too. So that's not necessarily an abnormal thought. It's a normal thought. It's just based on something that doesn't happen to be correct. So you forgot that you moved your wallet and therefore you think someone stole it. And so people with Lewy body can have a range of behavioral problems that are sort of directly caused or that are indirectly caused by their disease. Some people get very, very irritable. Some people get agitated. Some people get violent, either physically violent or verbally abusive, aggressive. And this can be related to some of the delusions or hallucinations that are also common, or it can be somewhat separate. Some people can have a range of other behaviors that are sort of mistaken for a quote unquote behavioral problem. So in the middle of the night, if you have what's called REM sleep behavior disorder and you're punching, kicking, moving in the night and you punch your bed partner, well, it's not that you're trying to be violent. It was a violent act, but it was caused by a sleep disruption. So some people have slowed thinking, slowed processing, and they're not as reactive and they think it's more family or caregivers might say this is more of a behavioral change, when really they just need a little bit of time and they weren't able to get out their response in time.
As far as behavioral and personality changes, I think I'm luckier than some caregivers. He was only a couple of times belligerent toward me. Once he tried to leave the apartment and our doorman stopped him in the lobby and brought him back home, and he was having a terrible delusion of fear and kept begging me, please don't hurt me, please don't hurt me. And he kept saying, my name is Paul and I was a school teacher and I've never hurt anybody, please don't hurt me. And it was very heartbreaking to me and difficult to calm him down. And the only other time he ever got angry in that way or belligerent was right one night. He just was defiant that he was going to leave the apartment, and I didn't want to let him, I kept saying, it's cold out. I kept trying to distract him, and he finally said, if you keep stopping me, I'm going to have to hit you. And I said, well, I don't want you to hit me. He said, I don't want to either. So that's as far as we got to almost being violent.
A lot of anxiety. And I have tremendous disappointment, at the way that this is interfering with my life. I didn't want to change so many things. And I have had to change a lot of things. So I'm resentful of that for sure. And I'm trying to be safe. I didn't realize so many things I did were considered dangerous.
Lewy body sufferers, they have a tendency to become, and my neurologist asked me this, and I described it as like, there's like a wet blanket placed over your life. I mean, you still understand life, everything's there, but you're a little apathetic. You don't really get involved in things. Things don't excite you like they used to anymore. And I myself, I don't know if this is true of others, get very anxious when I'm going to have people over now. I'm not sure why that is. I think it's because I'm uncertain how I'm going to be feeling or how I'm going to be acting. Am I going to be doing things right? I've learned with my wife, loving wife, to help me that people don't really care about that anymore. I mean, they want to see me, and if I forget what I was talking about, it's no big deal. But I don't jump out of bed excited to do things.
So another significant part of Peter's Lewy body was apathy. He was just so apathetic. You really could not motivate him really to do anything. There was nothing. We tried Alexa Pro to hopefully help that, but that really didn't. That sort of backfired. I don't exactly remember what happened with Alexa Pro, but it just didn't remove the apathy that he was having. So apathy was definitely a big part of Peter's illness, and probably still is.
My husband and I have been married 45 years in October, and we've had a great, and I'm not just saying that, we've really had a blessed, wonderful marriage. We rarely argue. Well, 6 months before the diagnosis, everything was getting to me. I was very irritable, and I would pick on little things, and it got extremely bad. I mean, it was every day, and it was usually late afternoon on, to the point that both of us thought, we can't live like this. You know, everything was bothering me, so I thought I couldn't live there. And I was driving him crazy because of my behaviors. So, since I started the medication for the LBD, that has let up tremendously. It's not an everyday thing, but I do find that after 5 o'clock, well, the neurologist told me not to do anything stressful and basically not to do anything that wasn't fun or pleasant. And so the combination of the medication and his suggestion, occasionally will catch, my husband's very good at catching himself when he sees that I'm reacting irrationally, usually, where normally something wouldn't bother me, and now it's a great big grand deal. He catches himself, he can see it coming, and I normally can catch myself. I can hear it, I can feel it, that I'm going to be not a very nice person to be around.
The treatment of dementia with Lewy body is very multifactorial and really needs a team approach, because although there's no real cure for dementia with Lewy bodies, there's a lot of things that we can do and things that we need to avoid in this condition. So, one of the most common symptoms is hallucinations. And luckily, there are several medications that we can use to treat those hallucinations. And oftentimes, I work closely with our psychiatry colleagues to help with this. But there are a few medications that are safe to use in dementia with Lewy bodies for hallucinations. One is called Seroquel or quetiapine, which is what's called an atypical antipsychotic. And this medication is used in a lot of other conditions, but it's one of the safer medications in dementia with Lewy bodies. Another medication, which is a little bit stronger and a little bit more complex to deal with, is called clozapine, or Clozaril is the other name, which was not to be confused with clonazepam, which is a very different medication. But clozapine is also an antipsychotic, and it does work very well in dementia with Lewy bodies. The problem is you need very frequent blood draws to keep track of your white blood cell count to make sure that doesn't drop. But it does work very, very well. There's also a medication that's currently approved for Parkinson's hallucinations, not yet approved for Lewy body hallucinations, but my thought is that it will be shortly, is a medication called Nuplazid, which is very safe in this spectrum of diseases and has a very unique mechanism, and it seems to not worsen any of the physical symptoms of dementia with Lewy body. So those are kind of the three medications that we sometimes use for hallucinations in Lewy body dementia. When we talk about some of the other symptoms, it really kind of comes down to each individual symptom as far as to how we treat it. So sleep is a huge problem in dementia with Lewy body, and there's 4 or 5 medications that we oftentimes can use in this condition, in the sleep component of it. So mirtazapine or Remeron is the brand name for it, is a common medication. Trazodone is another common medication. We oftentimes use Seroquel as well for sleep. Now, all these medications aren't perfect, but at appropriate doses, they're relatively safe in dementia with Lewy body. And one of the things that's important to understand about this condition is there's a lot of sensitivity to medications. So even the best medication may not work for a dementia with Lewy body patient. That's why it's important to have an individualized therapy, because some medications may work, some may cause side effects, and some, unfortunately, may actually worsen the condition if the doses are too high.
I take rivastigmine, which is the patch, and that's supposed to be for memory. It's really hard to tell if it's helping or not. But I've been on this for like 2 years now. I can't say that things are really, well, my memory is not good at all. And the rivastigmine is really the only medication that I'm taking for the Lewy bodies. But I do take for anxiety, what is that, Zoloft, which I believe, which is more for anxiety. That seems to be making a little bit of a difference, but I'm much more anxious than I've ever been. It's still not normal. Those are really, that I took Aricept when I was first diagnosed, and I went home and I got very sick from the medication. So I stopped taking it, and it turned out that was the medication that I was taking was more for Alzheimer's. And so I really have, other than supplements that I take, I don't take any other prescribed prescriptions.
Initially, what was prescribed medication-wise for Nikki was donepezil. Why? Because it was said that if there was anything good happening in the brain, it could stimulate what was good. And he stayed on that. He had no side effects from it. It was fine. Very late in the game for him, like a month before he actually died, he was having really bad anxiety issues and anger issues. And our general physician felt that Seroquel might be helpful. And for most people, it probably would be. For Nikki, it had just the opposite effect. It actually made him more aggressive, more angry. I mean, it was frightening to see what happened. And we weaned him, I guess I allowed it to go on for a couple of days before I realized this is really bad, called the doctor, and we weaned him off of it. But he never went completely back to being anywhere near tranquil after that. The Seroquel had triggered something else in him, and or maybe the disease, or maybe the combination, but it was just not good. Medications, as we all know, or as we hopefully should know with LBD, is that medications some medications are very, very dangerous, and you have to be extremely careful about what you give somebody with LBD.
There are certain medications that didn't agree with him. Seroquel actually worked the first month. It was wonderful. And then all of a sudden, it wasn't. It made him, we learned later, it made him want to move and want to run. And it made him angrier at times. But he bolted, he took off. And I later learned that about 15 or 20% of people who take Seroquel with Lewy body will have that will have that side effect.
I could have a couple come over for dinner, and they'll say things like, "Joel, I've been here for an hour already, and you know what? I don't see any difference. You look exactly the same. I don't believe you have this disease," okay? And I don't have a bad temper, but I came very close to going bonkers, okay? Because I tried to explain that it depends when we're together, okay? I don't experience these symptoms the same time in the same place. They very rarely duplicate one another. So maybe you need to research and find out more about about this disease, and then maybe we could have an intelligent conversation. You know, they get very angry with me when I say things like this, but it has happened at least 10 to 12 times where when I see the same person, they bring up, and I know they're trying to be nice. I know they're not trying to be nasty or anything like that, but it's a very sensitive issue. And one of them was walking by when he thought I wasn't listening to a conversation, and they said loud enough for me to hear, "Do you think Joel is lying to us?" And when I found that out, I said to myself, I don't know if I could be friendly with a person like this. I really, really can't. It hurt me that much that I had to keep justifying over and over again this illness that I was going through.
For someone who has Lewy body dementia, or any dementia for that matter, the tone of voice, the way you speak to someone is all important. When Nikki was first diagnosed, we together made the decision that we would tell our friends what was going on. Why? So that they wouldn't be wondering and I wouldn't say gossiping, but chatting behind the scenes about what was going on, and or being alarmed by some things they might see. So we told everybody. And why? Because of this very thing about how you approach somebody with Lewy body dementia. You know, the minute someone thinks that there's something wrong, they start talking louder. You know, that kind of nonsense, which makes somebody feel so awful. So it's very important to keep an even tone, to keep talking as you always would to someone, whether they're understanding you or not. They are getting the vibrations. They're always getting the vibrations. That doesn't change. And you may think, well, they're not understanding what I'm saying. They may not be getting the words, but they sure are getting the feeling of what's coming to them and at them sometimes. So the calmness, the gentleness, the sweetness, the lovingness, and the dignity. I'm very high on the word dignity because I know that one of the things that was most important to Nicky was his dignity. And one of the first things he said to me after he was diagnosed, after he said, "Look, we've had a great run. We cannot be sad." And that's a mantra I live by today. Same mantra. But he also said in the next sentence, "Please, Mary Lou, help me keep my dignity." That's huge. I still get choked up on that one because I was vigilant. I was very aware the whole time of allowing Nicky to keep his dignity. And if that meant, again, the 2 hours of getting dressed in the morning, then that was allowing him to keep his dignity. If it was allowing him to state whatever he needed to state, as we were going out with friends to a restaurant, we were sitting as a foursome, he would say something, I would let him get it out, and then I'd very gently guide it back to where I knew he wanted to go with it. It's a gentility. It's not easy to do, and I'm not going to sit here and say, you just do this, here's the formula, this is what you do. No, that's not the way it goes. I mean, there are times you want to scream. You want to just use every expletive that you can think of. And you have to do it, but never in front of the person, never in earshot of the person. Go into another room, scream into a pillow, do what you have to do, but don't let the person that you're caring for see it.
I think there isn't one just correct way to communicate with someone with Lewy body dementia because of the fluctuations, you have to fluctuate yourself. You have to go with the flow. So if my husband was pretty with it at a certain time and knew who I was and could just ask me questions. And I mean, literally, sometimes I would feel fooled. I knew he wasn't better, but there were times when he seemed so back to normal for an hour that I would think, oh, maybe this is it. Maybe he's now going to be okay. Which was, you know, very much wishful thinking. But then those were times I could actually, it was like having Paul back. It was like having my husband back. And so I got to talk to him almost like normal. And sometimes I would laugh at myself because I'd argue with him the way you argue with your spouse, as if he could argue with me. But then it would become clear that he couldn't follow an argument. It wasn't a fair fight. So I learned that I had to remind myself, even when he seemed normal, that he still had Lewy body dementia.
It took me a while to understand how to speak with my husband. I would get very frustrated with him at first. He would use the wrong words. It would take him too long to get the words out. And as he progressed, I just learned to slow down and to listen. And when he would say that, you know, there's a dragon out the window, I would say, oh yeah, I see it. Well, you know, but it's far, it's not going to hurt us. Isn't it pretty? You just sort of go with it. And you let them speak and just sit with it and not try to finish the conversation. Just be.
So at one point, my mom had a therapist come and work with us. And that speech therapist gave my mom the language to talk about how she wanted people to communicate with her. She shared a story about how, well, what she said is, ask me a question. So my mom asked the therapist a question, and she turned her timer on her watch, and the therapist didn't answer for 10 whole seconds, just sat quietly for 10 seconds. And then she answered the question of my mom. And then she said, did that sound like I wasn't listening to you? So long of waiting? And my mom, of course, said no. And I thought, well, that was a big blank space of no talking. And the therapist said, somebody with Lewy body or Parkinson's or other dementias, it can take them 10 or even 20 seconds before they can find the answer. And so people need to give them time to say what they need to say. Well, shortly after that, my mom, one day we were talking and I was, said, give me my 10 seconds. That she knew she wanted to say something and I wasn't giving her enough time to say what she wanted to say. And so communicating with somebody, even if I ask once, if I ask again, she may still be thinking about the answer. And so to not just feel like she's not listening or she didn't hear me or that, and lately she started to tell me she needs 20 seconds, not 10 seconds.
The best way to communicate with a Lewy body dementia patient is with love. Your words have to be seasoned with love. So you have to have a lot of patience, you know, giving them time to think, you know, speaking a word for them so that they will say, yes, right, you know, and so that they would feel like, you know, they're still here on earth.
What I would have liked and still do would be somebody to ask me, what would help you? You know, this is a hard journey. What would help you at times when the journey's got some bumps in it? And for me, it's really simple. It's just a really big hug, you know, just hug me. And if I need to cry, I'll cry. And that's what I need. But nobody asks me what I need. There are some people I'm comfortable enough with that either they know or they don't know, I'll go up and hug. But I guess if you do know, it's okay to talk about it. I think the person that has the Lewy body doesn't want it to be necessarily a secret and wants to be able if they are having a bad day, to ask for help, or if they are having a grand experience, to share it. So I would say be willing to speak to them and look for ways to make it positive to hear. Not that, oh, it's no big deal, or it'll go away, or nothing that is not true, but ways to look at it in a positive way. And even something as simple as telling the person, I'm glad I can be here for you.
You have to be patient, number one, and you have to be, I think sometimes you have to put yourself basically in the head and think like they think, and realize that the things that they're doing is not what they want to do, but it's what they feel is best for them at that particular time. And sometimes it might be the wrong thing, but telling them that it's the wrong thing is not going to help. So you have to find a way in which I personally am able to get my husband to do a lot of things by just being really kind and loving to him. He responds very well to that, and I do not confront him. If he's saying something that is not whatever, I just don't confront him. I just say, okay, or I listen to his conversation. Sometimes he tells me a long story about something that has nothing to do with anything. I might ask him a question about something, but he tells me something completely different from what we're, talking about. But I just listen. I listen, and I agree with some of the things that he's saying, because whatever he's saying makes sense to him. And, I just go ahead and go along with that.
How to speak to somebody when living with Lewy body, and how to talk to them. Well, first of all, you have to make an analysis of how advanced they are. Some people are very advanced. Other people are still communicative. But I always say this, and I do this with really everybody in my life. It's not only with Lewy body. I don't care if I'm speaking to somebody with terminal cancer or whatever. I speak to them as a human being. That's all you have to do. You don't have to say, I wonder if they're worried they're going to understand this. I wonder if they're going to do this. Just speak to them as you'd speak to your loved one. And be aware that if they are suffering from Lewy body, and this, they may not recognize all the words, or they may not understand fully, or they may have a disturbance, or something may happen. They may have a outburst or something, but you don't have to react to it just like anything else. You just talk to them and understand you're talking to somebody you know or love. They have a disease, you might say they have a broken foot. You'd still talk to them the same way. So just be understanding is the main thing, because I think if you get frustrated with somebody with Lewy body, what was that? Or what? And if you get frustrated with them, I think that's going to have a negative effect on the Lewy body patient, because then I know what happened to me. I would get anxious. If you yelled at me or you said, what did you say to make any sense? I would get anxious, and then I would shut down, and then I would probably cascade down. So just talk normally and understand that they may not be able to have a completely normal conversation with you, but they're still people. They understand, they're loving, they can feel you too. They understand you. They don't it's just not words. They're looking in your eyes, they're feeling you. Maybe you touch their arm. It's all of that. Communication, is 90% nonverbal. Most people don't understand that. They think it's all verbal. It isn't. And I've studied communication all my life. It's really nonverbal. Looking at them and smiling, a warm touch, and and just talk like they're anybody else. Because if you talk down to them, they're going to recognize that. So you just be your normal self. That's all.
We're no different to anybody else. Speak to us like you would speak to anybody else. Okay, we might come out with some jam jumbled words sometimes, but within those words, if you listen, you might make some sense out of it. Because sometimes when people have Lewy bodies or any dementia, and they're having some of the words, more so with Lewy's, and they're having some of the words and they can't get it out. Sometimes you'll hear the word pain. You can pick up on that. Sometimes you'll hear the word thirsty. Sometimes you'll hear the word hot. And we are trying to say how we're feeling at the time. And if you can pick up on that, you will help enormously. Because I always use the example, Lynn, Norma, is, can you imagine having toothache and not being able to tell anybody you've got toothache? How horrific would that be? But if you listen to people with dementia and you talk to them and you try and understand them best you can, and have just a little bit more patience. But anybody else with Lewy bodies, why would he talk any different? I've had people say to me, "Oh, I'm sorry, I didn't know you had," and I said, "Why are you talking funny? You know, why was your voice suddenly changed? You know?" And they always drop the shoulder. Have you noticed? If you say to somebody, "I've got dementia," they go, "Oh, I'm sorry." And the head moves. It goes, "Oh, it's called the dementia drop," we call it, right? And they always go, "Oh, I'm sorry." It's all that about. They don't need to be. I have dementia. I have a disease of the brain. You probably got, I don't know, you probably got backache or leg ache. You might have appendicitis. But people don't go, "Oh, I'm sorry." You don't go really quiet, do they? That's the difference. You've got to remember that we're no different than you.
There are feelings that we still share. And sometimes he'll just reach up and give me a hug, and he'll tell me he loves me. But it's very difficult to share on an equal level when somebody's so cognitively disabled right now. So I have to count my blessings for what we've had. It's not going to happen again. It's not going to get better. I just hope I'm prepared and able to keep him as safe and comfortable at home as long as I can. And that would be my best wish for a future.
Well, what's frustrating to me is that I have no control over what kind of mood, temperament, anxiety level, confidence level that I'm going to be on a day-to-day basis. There's very little warning. Like I said, I may have a runny nose every once in a while. But that's frustrating because I can't control it. I'm very much of a control freak. And when I don't have control over things, it makes me anxious. And this is an example of that. I'm very frustrated in not being able to complete day-to-day tasks. I'm very frustrated that there's so little I can do about it. You know, I understand that there's only so far I'm going to be able to go, and provided there's a miracle someday that, you know, hey, this is very strong. I try to tell people this is not a death sentence, you know, and if you utilize your time in a good way, you could have a positive life. And I try to tell people, you know, you're wasting your life away. You don't know how much time you have left. And nobody wants this, but you have to try to make it better. I mean, living in fear, being so anxious, there has to be some kind of quality of living. And to me, that's very, very important.
So over the course of the 6-7 years that my husband has been diagnosed with Lewy bodies, there has been just so many losses in terms of him as a person, him who he was, who he isn't anymore. And, there are just new losses every step of the way. I really have I have no ability to have communication with him except, positive things that I say to him. There's not been really any responses in many years now, in terms of emotional responses. That has stopped quite a few years ago. But all the other losses are quite concrete, having to take over all of the financial aspects of running everything for him. Losses in my ability to even do my own work without having the distraction of or overwhelmingness of what needs to happen for my husband.
There's tremendous loss. It's loss after loss. And you think you've hit the depth of the loss, and you haven't. And I think that is the hardest thing emotionally is I've lost people I love to death, and I know my husband is dying right now. And it's just been so hard. And I would like to share that you can get so overwhelmed from caregiving that I would actually say to friends, I know I love my husband, but it feels just theoretical right now because I don't feel it. And that's a terrible thing to lose, is the feeling that you love someone. And I would say to myself, I must love him because I'm still caring for him so carefully and with such concern. I was his only advocate. I have been, and I still am his only advocate. And so I think that's a sign for caregivers. When you no longer can actually feel the love, you need help. You've taken it as far as you can. And so as much as I never wanted to put my husband in a nursing home, since he's there, and thank goodness getting very, very good care, very compassionate care from the hospice team and from the nursing home staff, I feel the love again, and that's back. And so I can feel the love as we go through this loss together. And that has felt very special to me.
I miss having a partner. That's the hardest thing, is just not having somebody to be there, not having that friend. Our roles have changed. I feel like I don't have a husband. I have a child that I have to take care of, and I've adapted, but it was very hard at first. I was very angry that I was put in this position. I just didn't think it was fair. But as he got worse, I started to lose that anger. And I just know that he won't be here one day.
The most difficult thing as far as this disease is my father's relationship with my sons. My father is such a big influence on my boys. my son's major in college stems from learning to fish with my father and the time that they've spent together. And my heart breaks that when they're together, it's even too much for my father, that I mourn my boy's relationship with my father more than I mourn for myself.
I have to let go of some dreams which are difficult. I saw myself at this point in life buying a big boat and sailing around the world, and forget sailing. And even the idea of a motorboat is precarious for me. I'd have to hire a crew. And then the idea of being on the water with my balance issues might not be the most pleasant. Letting go of dreams like that is difficult. And when those things happen, I try to remember the word abandon, just live life with abandon. So I sit there and fantasize about boats I can't afford. And, and the compromise that we've come up with is we hope to eventually, maybe next year, take a cruise to the Greek Isles on, like a big cruise ship. So that would be our compromise.
The most difficult moments for me is not having my husband. He's here as a person, but the things that we enjoyed together, he doesn't enjoy anymore. He doesn't have any effect on him. Would love to just get up and go, or let's go so and so, without thinking. If I have to get him to go out now, I have to think like 2-3 hours ahead, and continuously tell him we're going so and so, we're going so, until the actual time comes for us. It's just, you can't do any planning or any big planning before. I miss him. I miss him.
I wouldn't trade this for anything. It was so important for me to be able to be here to care for my aunt and to go through this. It's a journey. I will be able to carry on her legacy. So for her, I will do my best. She was the best of us. She is the best of us, of our family. And I've had, even though I wasn't able to walk down the street with her in her heyday and get words of wisdom through my upbringing, she raised me now, because I just couldn't, I didn't have intentions before. You go through life and it's like, I stumbled, in academia. I've never left. I just went to college, kept going, and just never left. My job is at an academic institution, and you never have to grow up there. You don't have a regular schedule. You don't have to. So, but she not only did she make me live in New York City, which is when I understand why people say it's the greatest place, it is incredible. But she, even through her dementia, she's taught me and she's shown me how to care for other people.
When you're facing something serious like this, and I don't want to be too negative here, but it is a terminal disease, you begin to realize life's importance. And don't bother so much with the little things, they really mean nothing to you anymore. It doesn't mean anyhow. Thing you'd see something and get disturbed. And I was that way too, and I just shout at the TV or something. So it actually gives you a blessing of calmness in a way. I am not afraid. I am not worried about what's ahead of me. I don't know what's ahead of me. I understand it should probably get worse and things, but it doesn't worry me. I've come to a calmness in accepting that this is my life now. And I recognize, we say this all, so many people have so much worse than I do. Oh my goodness. I mean, I'm blessed even with this terrible disease. And this, you just have to go to look at the Ukraine, and we all see that right now. So many things could be worse. Yeah, and my wife was just pointing out to me, I have 4 grandkids who come over and they know Papa is sick, in the sense that I got to be careful of fall and things like that. And so they want to jump on you and everything, but they're so blessed. Oh my gosh. I told my wife they went to Florida for a week, and they seemed they'd be gone like 3 months because they come over and visit right away. I perk up. So there's like anything else in life, there's ups and downs and goods and bads. And I'm trying to look at the good side of it, even though there's some bad sides. Try to look at it and realize that, life is still good. Life is still good.
Just appreciating how much I rely on Jerry and how much he is able to do, that I always thought, oh, I have to do all these things. These are all my responsibilities. I have to do it all, and you just do this you just do these few little things, or I'm the one, I'm the center of the universe. And suddenly you think, no, I'm not the center of the universe. And I think, so the blessing is you realize, he is very capable. I mean, remarkably capable. I mean, here he is collecting all of our information for taxes and getting it ready, and he's getting it ready for the tax person and organizing it and filing it and tabulating it. And I'm thinking, oh my God, I can't even use a calculator without going back 4 times to double check 4 numbers, or ask me to do 3 things. And it's like, oh my God, he's asked me to do 3 things. So, and sometimes I have to say to Jerry, wait a minute, only ask me to do 2 things. Then I can come back and say, did you need me to do anything else? Because otherwise it's just, I can tell when it's going to be like, oh my God. So the blessing in that, it sounds like a curse, but it isn't. The blessing is realizing there are limitations, and I have to learn how to live within those limitations.
There are good things from horrible things. I find that I'm becoming a better listener than a talker. And if you had asked me that 25 years ago, I would say, I think you're on something, because that's not me. But it really has, I think I definitely become more empathetic to people, more patient. So yes, I think you could very easily extract good things that come from bad. Absolutely.
Well, if you can find the sense of humor and share that with like a friend who knows you really well, and you both like slightly dark humor and sarcasm, maybe that's someplace we can go to have a good experience that's cathartic, and you have to not get lost there, though.
The silver lining is that he's sweet to me. he he's so happy to see me, and he loves to hold my hand. He loves to tell me how beautiful I am. There's a sweetness about him now, and he is in a memory care facility where he is the youngest person. He's in the moderate unit, so most of the people there are physically in better shape, but you could tell them something and they won't really remember. They'll keep asking. He has the memory, and they love him. They think he is the sweetest. They call him the kid. They love to dance with him. It's very cute. One thing Mark likes to do with me when I come visit is also dance. He loves to dance. And so when I see him, I hold him, I hug him, and we dance. He loves listening to Miles Davis, so we listen to the music. And we never did that before. But again, he just always tells me how lucky he is and how he loves me. And he always asks for his family. Where's my daughter? Where's my wife? Where's my dog? And when I bring Lydia, he lights up. He's so happy to see her. He has this twinkle in his eye when she walks in, and it's very sweet.
Make no mistake about it, Lewy body dementia is a nasty and cruel disease. But unlike Alzheimer's, which you lose a person gradually, but they never come back, with Lewy body, there is that in and out aspect of it. Now, you can look at it and say, well, that's really cruel because you get false hope. Well, yes and no. Yes, you get false hope, but you know that it's not going to stay. But you do have those beautiful moments when your loved one is 100% there, where the moment is to be treasured because it may never come back, or it may come back, and there's a hopefulness that you'll see those glimpses every now and again, and you do, and you really do. But when someone reaches over and hugs you, or pats your hand and says, thank you, those are the moments that you treasure. They're also the moments that you remember. It's interesting as you get distanced from death, you do not remember necessarily all those moments of horror. You remember the moments of great good and great love and great mutual caring, because it's not just you caring for your loved one. It is your loved one also caring for you. Somewhere in there, that person still exists, and that person is still there for you.